watching, and we encourage you to share it with your friends and families and churchgoers and so on. We believe, and we have consistently believed, that information is critical to combating and not getting the virus. And so the more the viewers and listeners share the information and share it with their families and friends and others, the better the community will be. We know that right now we're in a critical time in terms of new cases. Deaths are up, everything is up in our numbers, and we're working to try to break that upward trajectory to flatten the curve and reduce the curve. It's going to take some time, just based on the statistics of the virus. The transmission rate that scientists talked to us about from Texas A&M proves that, and they've proven it out with graphs and charts over time. So our goal as a community is to minimize and reduce the spread so we can reduce the curve. And so with that, let me go over some of the statistics for today and what's happened since last Thursday. And so first to report is the number of new cases. Even though testing is at a low point at this time, because, and to some extent because of the holidays, but more so from a city-county standpoint because of supplies, and we're getting some of those, and I'll brief you momentarily on it. But even though testing's at a low point, you can see the number of cases still continue to increase. And so for today, we're reporting 288 additional new cases. If you look back, since the last time we were here was on Thursday, which was the 7th of July. So on Friday, we had 254. Then Saturday had a big number, 321. Sunday at 203. And then today at 288. So the cases continue. You can't tell the prior because this graph, but if we recall back to several months ago, we were often reporting zeros, 3s, 5s, maybe an 8 every once in a while. This is not normal. We don't want this to, it is normal for the past couple of weeks, but what we want to be back to is single digits or zeros, and that's what we had. So if somebody's joining in now thinking this may be normal or business as usual, it's not. And when we first started reporting, we had zeros, 3s, 5s, a couple of days with zeros in a row. That's where we want to get back to. This next chart here shows us the active cases compared to the recovered cases. And we're still at about 88, 89% active cases, over 3,600 active cases out there in the community. About 450 people have recovered, and we have 18 deaths, and I'll go over those in a minute. In total, when you look at the active and the recovered, we're over 4,000 cases now in Nueces County. I mentioned everything's on the rise. Here is a chart on our hospitalized patients. That continues to go up. We know that our hospitals are taxed in terms of ability to deal with the patients. There's several hospitals that have entire floors, numerous floors that are just all COVID patients. And we do appreciate the nursing and associated support staff, the doctors, the whole hospital systems. We know that throughout all of Texas, they're burdened at this point and at capacity or over capacity. And we hear or we have read that several cities are shipping patients to other cities that might have capacity. And I haven't heard that we're doing that yet, but we do have, the hospitals with our coordinated system does have contingency planning in place, and they continue to activate those layers as more and more patients get admitted. So 269 in the hospital today. That's up from 240 and up from below 200 when we last reported before the 4th of July break. And then number of patients in ICU also continues to go up. There's 88 persons today. And on July 2nd, our last report that we were here, we had 55. It was somewhat of a drop from the prior day of 58. But you can see it's back up to 88 persons in ICU today. And then the number of deaths is worrisome, 18 in total today. You can see this line graph kind of shows a long period of the same number of deaths. The story is that for 3 months, we had 3 deaths in total. And now just in the past couple of weeks, we've grown that by 15 persons, right? So once you get to here, it continues to go up by 15. I just want to recap it since somebody may be just trying to get their numbers together. So on Thursday, when we last briefed the community, we had 9 deaths. And then on Friday, there was 1 death. On Saturday, there were 3. On Sunday, there were 4 deaths. And then early this morning, there was an 18th death, 1 death this morning. So 9 on Thursday, and then over the past 4 days, 9 additional, for a total of 18 deaths in our community. Most of the persons had some form of comorbidities, to include obesity, heart issues, and so on. But a couple of them have been younger patients. This morning was a 27-year-old person who only comorbidity was obesity. So we'll continue to watch that and report out to the community. Okay, the last 2 charts just show some trending. So the daily tests and testing, and I'm going to tell you where we can go for testing after we finish the graphs here. This shows, the lines show the daily testing that's taken place, and there's somewhat of a lag. So what's reported doesn't mean the test actually took place that day. That's just when institutions are reporting it to the health district. But you can kind of see we had a lot of testing going on just before the 4th of July break. That's when the city was doing some real massive drive-through testing operations, but our supplies ran out. We did get word yesterday and over the weekend that supplies are coming to us. State legislative delegation has been helping to put pressure on the state to get more supplies to us. But you can see a pretty significant drop in what we had been doing to where we are. You can see the 7-day trend line is beginning to drop a little bit, and we don't want that. It should be going up. So as supplies continue to come in, we can increase our testing. But the daily 7-day average is 587 tests per day. But that's in large part because of these big 1-day spikes that we had in testing. And then number of cases, you can see that continues. It shows since day 1 all the way down there in April. And you can see this big tsunami of an increase in number of new cases that we have. A little bit of a drop here, but the line continues to go up. The 7-day average for a day is 281 confirmed new cases, if you look back at the 7-day average. Okay, so that's an update on the statistics on where we are, kind of an overview. Let me tell you about testing in the community, and then we'll have Annette Rodriguez come on through a WebEx. So the state continues to test here through the Division of Emergency Management and the National Guard. And those tests do require an appointment, so it's by appointment only. There's 3 locations this week. One on Thursday, the 9th, that is at in Robstown at the Richard M. Borchard Fairgrounds. Okay, this Thursday, the 9th, that's from 9 a.m. to 1 p.m. And then on Friday, the 10th of July, here at the American Bank Center, there'll be another testing event by the National Guard, also from the hours of 9 to 1. And then on Saturday, July 11, back at the Richard Borchard Fairgrounds, and at the same time from 9 to 1. That's on Saturday, July 11. So those 3 testing events are all being done by the National Guard. They are all by appointment only. And I'm looking to see if I have a number. We do have a number. Oh, it's not on the screen here, but if you wanted to register for an appointment, you want to call 512-883-2400. Okay, so that's the number to call if you want to go to any one of those 3 testing sites by the National Guard. part of this Texas Division of Emergency Management. So telephone number to call is 512-883-2400. Okay, and then the city is going to, because we did get some initial supplies, we're going to resume testing tomorrow. But I don't have the details, but that won't help the community that needs a test, because we already have several thousand, as many as 3,000 persons waiting to get tested. And so tomorrow we're going to test about 200, and they've already been notified. So the site location, we had talked about it yesterday. Maybe Annette might talk to us when she comes on. But those 200 people have already been notified, and there's already several thousand that are waiting. So there's no point giving persons a number to call, because it'll be a week or two maybe before there's new availability to test more people through a appointment process. But there are several other persons in the community that are testing. So Amistad Community Health Center is continuing their testing Monday through Friday. And you can call 361-884-2242 to register for an appointment. So that's with Amistad, 361-884-2242. The Coastal Bend Wellness Foundation, they continue to test. Their appointment only Monday through Friday. And you want to call the Coastal Bend Wellness Foundation at 361-356-9572. And then CVS Pharmacy is now a COVID testing site, and they test daily by appointment only. And you want to call them at 361-814-8305. And then Physicians Premier ER is a test collection site, the testing daily but by appointment as well. And call any location for information that says regarding an appointment from Physicians Premier ER. And then the last one is Christus Promptu Urgent Care. They're a testing site as well by appointment only, and call any location for setting up an appointment with Christus Promptu Urgent Care. Okay, so those are the testing sites. Some are free, some are at a charge. And again, the city will resume tomorrow, testing about 200 persons in the community. Okay, so that concludes my portion of this afternoon's briefing. We're going to get it translated by Gabby into Spanish, and then we're going to put on Annette Rodriguez via Skype, who's going to talk to us about COVID-19.
En resumen, las cifras más recientes indican que en las últimas 24 horas se han reportado 288 casos confirmados por el coronavirus, haciendo un total de 4.084 casos. 449 de los 4.084 se han recuperado por completo. 269 personas continúan en el hospital. De esos, 88 se encuentran en la unidad de cuidados intensivos. La mayoría de los tratamientos, a la fecha se reportan 18 fallecimientos. La mayoría de los fallecimientos son pacientes que contaban con otra condición de salud preexistente. El más joven se encuentra en sus años 20. La toma de pruebas por parte del Distrito de Salud continúa disminuyendo por falta de recursos, pero nos llegó información que recibiremos más recursos en los próximos días. Por parte del Estado se continúan llevando a cabo la toma de especímenes, pero solo para quienes cuentan con cita. Estas pruebas son llevadas a cabo por parte de la Guardia Nacional. Para conseguir una cita, debe de llamar al 512-883-2400. Esta semana se van a llevar a cabo 3 eventos para la toma de pruebas. El distrito cuenta actualmente con 3,000 personas en la lista de espera. El día de mañana habrá un evento para tomar al menos 200 pruebas. Otros lugares a llamar para poder realizar una cita es en las farmacias CVS al número 361-814-8305, la Clínica Amistad al número 361-884-2242, a la Guardia Nacional al 512-883-2400. También puede llamar a la Fundación del Coastal Bend al 361-356-9572 o hacer una cita ya sea en Physicians Premier o en Promptu Urgent Care.
Good afternoon. Annette Rodriguez, Public Health Director. The increased number of cases in our community have negatively impacted our hospitals with many more sick and deaths that could have been prevented. Everyone was asked to do their part, wear their mask when out in public. If we had all done this, we should not be seeing such high rates of transmission. No one has protection against this virus. There is no antiviral medications that you could take to get better. There is no vaccine to prevent you from getting the virus or keep you from getting severely ill at this time. But we can wear a mask when we leave home, and we can limit our public outings. We can stay indoors as much as possible until we have a vaccine to help decrease the unnecessary spread of the virus. We can distance ourselves from others that are vulnerable to keep them out of harm's way. These are not difficult things to do. So if we aren't doing them, maybe we don't understand how germs are spread. Or maybe we're just lazy, or maybe we simply don't care. I want to believe that we just don't understand how germs are spread. So I'm going to explain how these germs could easily be spread and how it could have easily been avoided for all these COVID-19 cases. We currently have 31% of our total cases in Nueces County that are between the ages of 16 and 30 years of age. Some, not all, in this age group think they're invincible, and many don't believe for 1 second that them getting sick has any impact on others. So again, I'm going to ask if you have children that are teenagers or young adults, please help us in explaining to them how this virus spreads. Here's an example. 20-year-old Mary goes to the beach. She doesn't wear a mask because no one wears a mask at the beach, and she comes in contact with many strangers. Mary ends up with a headache, stomach ache, and diarrhea, and isn't sure why she's feeling so terrible. Later, her body aches and she has chills. Mary decides that she needs to run to the grocery store to get some Pepto and Tylenol because she's feeling so sick. At the same time, Grandpa John remembers that he needs to go pick up his prescriptions at the grocery store. Grandpa John knows he's a vulnerable population because of his age, and he's also a diabetic. So he is very responsible and he wears a mask. But when he gets to the front of the line, he knows that he needs to speak to the pharmacist, so he pulls down his mask. While he is speaking to the pharmacist, Mary comes over, where Grandpa John is, to grab the Tylenol bottle. When suddenly she finds herself having to sneeze. She tries to cover her nose and mouth, but she's holding the Tylenol bottle in her hand, so she can't do so very effectively. Grandpa John nervously pulls back his mask, and he pays quickly, and he leaves the grocery store. A few days later, Grandpa John feels like he's coming down with the flu. His body aches all over, and he can't seem to get out of bed. Within 24 hours, Grandpa John is struggling to breathe and calls 911. Mary never sees Grandpa John again, nor does she know that Grandpa John passed away a few days after being admitted to the hospital. Mary feels better. 2 or 3 days later, she feels like she's fine. She's really ready to go back to the beach again and get out of this heat. Mary can't understand why all the fuss over coronavirus. She even thinks maybe she had it. She's not sure, but it wasn't bad. It only lasted a few days, and she recovered just fine. She's also telling everyone that she was right. She never spread the virus to anyone else. So why are so many people making such a big deal? Mary never got tested. She's no longer feeling sick, and she goes out and continues to spread the virus. How does she spread the virus? By talking to others back at her job, at the restaurant, and at the other places she's going to without wearing a mask. Mary continues to spread COVID-19 for the next 11 days. What did Mary do wrong? Mary was supposed to wear a mask. She didn't. Mary was supposed to distance herself from other strangers. She didn't. Mary was sick and was supposed to stay home. She didn't. Mary was supposed to stay home for 14 days, the entire period she could spread the virus to others, and she didn't. Mary was supposed to practice good respiratory etiquette and cover her nose and mouth completely. She didn't. Where did Grandpa John fall short? Grandpa John was vulnerable and was supposed to stay home, and he didn't. Grandpa John was supposed to ask family to go pick up his medicine for him, but he didn't. Grandpa was supposed to wear a mask the entire time he was out in public, but he didn't. Grandpa was supposed to stay home. but he didn't. I share this example because we are seeing this happen currently. Mary doesn't see the germ she's spreading, so therefore Mary believes she isn't harmful to anyone. The Marys of the world are extremely harmful and must understand how this germ is spread from person to person if we're going to be successful in stopping the spread. Some people will die when they get the virus. If you have a Mary in your family, regardless of their age, please don't allow them to be part of the uninformed super spreaders. Explain to them how this virus is easily spread to others so they can be part of the solution and not part of the problem. The two public health requirements that I'm going to discuss quickly, and we must all follow when dealing with a communicable disease, for this one being COVID-19. The first, everyone positive for COVID-19 must be isolated for 14 days, period, or they will spread the virus to others. They must be isolated even if they are no longer sick. They can still spread the virus at any time during those 14 days. Failure to do so is a criminal offense under the Texas Penal Code, Section 22.02. The second requirement is everyone that comes in contact with a positive COVID-19 must be quarantined for the entire 14 days, or they could potentially spread the virus to others. So even if they have been tested and the test is negative, they must still be quarantined for the entire 14 days, or they could spread the virus to others. Failure to do so is a criminal offense under the Texas Penal Code, Section 22.02. If we could get everyone to follow these two public health requirements, we would not have the number of cases that we currently have. Don't be a super spreader like Mary. Stop the spread of this virus in its tracks. The health district is going to resume drive-through testing beginning tomorrow, as City Manager Zanoni mentioned. But we do have almost 3,000 people that have already tried to sign up for this drive-through. So they are going to be the individuals that we are calling back first. This call is going to be through a reverse alert. We ask that if you have already called the health district and you are symptomatic and trying to get a test, that you pay attention to your phone, because the reverse alert will go out and you need to respond to it. So one, confirming, yes, I still need to get tested, or two, saying, I already got tested, I don't need a test any longer. We would appreciate that confirmation or the denial. So stay well, stay safe, and as always, stay informed. Thank you.
En resumen, el aumento en el número de casos en nuestra comunidad ha impactado negativamente en nuestros hospitales, con muchas más personas enfermas y muertes que podrían haberse evitado. Se les pidió a todos que hicieran su parte y usaran el cubrebocas cuando salieran en público. Si hubiéramos hecho esto, no deberíamos ver tasas de transmisión tan altas. Nadie tiene protección contra este virus. No hay medicamentos antivirales que pueda tomar para mejorar. No hay una vacuna que lo proteja de contraer este virus o evite que se enferme gravemente. Pero podemos usar un cubrebocas cuando salimos de casa y podemos limitar nuestras salidas públicas. Podemos permanecer en el interior tanto como sea posible hasta que tengamos una vacuna para ayudar a disminuir la propagación innecesaria de este virus. Podemos distanciarnos de las personas que son vulnerables para mantenerlos fuera de peligro. Es muy fácil la propagación del virus, desde una salida a la playa sin la utilización del cubrebocas, así como una salida a la tienda, especialmente los jóvenes, quienes tal vez piensen que su sistema inmune no los va a enfermar, pero puede ser quienes con más facilidad propaguen el virus a una persona más vulnerable, como los ancianos o personas con sistemas inmunes débiles. Existen requisitos de salud pública cuando se trata de una enfermedad transmisible como el COVID-19. Todos los que sean positivos para COVID-19 deben estar aislados durante 14 días completos o propagarán el virus a otros. Deben aislarse incluso si ya no están enfermos. Aún pueden transmitir el virus en cualquier momento durante esos 14 días. No hacerlo es una ofensa criminal bajo el Código de Salud y Seguridad de Texas. Segundo, todos los que entren en contacto con un COVID-19 positivo deben estar en cuarentena durante los 14 días completos o podrán propagar el virus a otros, incluso si el resultado de la prueba es negativa. Todavía deben estar en cuarentena durante los 14 días completos o podrán transmitir el virus a otra persona.
Thank you so much. Barbara Canales, Nueces County Judge. Well, July 4th weekend is, in my opinion, at the close of midnight tonight, I guess officially over, and I have some news to report. I really want to thank all of you who helped us here in Nueces reduce the spread of the virus this weekend. I think we did a very good job. And not because I say so, but because the drone coverage says so, because the automatic tickers over the causeway say so. We were able to compare numbers from Memorial Day to July 4th weekend, and I can tell you that it is a drastic differential. There is no doubt that we heeded the warnings from our health department officials, from your city electeds, from people that you trust and confide in the health world, and from our judge's office. I am grateful because what we did this weekend will impact us in the next 2 to 3 weeks. I want to have us keep it up because the battle is long from over. What we do every day over the next 30 days will determine the fate of our summer. And I know with confidence, after the most tempting of all weekends, July 4th, when we have such an earnest desire to go do the things that we love so much, like the beach, being outdoors in our big family picnics and our barbecues, the things that come so naturally to us, we're asked to stay away from for the betterment of others. We did it. And so because we did it, we can keep doing it. I've been thinking a lot about this weekend and wondering if I'll ever feel the way that I felt this weekend. Every hour, receiving a text from Annette that somebody, a father, a grandfather, a mother, had died. Every hour, it felt like it wouldn't stop. And I wanted to make it stop because that is the tragedy of this virus. It is so real. And you know what? In a strange way, we need to come to grips with the reality of the deaths of this weekend. We need to understand that somebody in their 20s died, somebody in their 40s, in their 50s, and yes, in their 70s and their 80s and their 90s too. And but for COVID, despite the fact they had other conditions, they were managing those conditions. And what precipitated their untimely death was COVID-19 and no other. And so you have seen now the statistics that Manager Zanoni has presented to you. We are continuing to increase in our hospitalizations, causing tremendous strain. Our office, through our city and county EOCs, have processed additional STAR requests to enable the state of Texas to send valuable medical personnel, mainly nurses, to both Christus Spohn and HCA, our two largest healthcare providers. We have expanded yet again in both of these units. And I'm not certain how many more times we can expand. We have some room to continue expansion. But I remember the days when we said, we have a 25-unit ICU bed and that'll cover us. And now we are looking at over 88 people in ICUs, 44 of which are on ventilators, which means they are in peril. And so, I tell you all this because I must recognize that, once again, our destiny is our own to manage. And although we have been dealt somewhat of a cruel hand, I just had an opportunity to tell somebody who's not from here what the best part of us is. What is Nueces all about? What are we like? How do we live? And the truth is that our greatest strength has also been our Achilles heel. Everybody wants to come to the coast. And despite the fact we messaged coastal distancing, the coast is not clear. It is not clear to come to at this time. We need to do everything we can to strengthen and enhance the protocols that we've come up with for our own family, for our own businesses. Of course, that includes wearing the masks, but it also includes making sensible and common sense decisions for ourselves. If we do so, in 30 days, perhaps the charts will once again reflect that we have reversed this trend, but it's going to have to be with tremendous due diligence and vigilance if we hope to see that happening. Averaging another 200 plus cases every day has a cumulative effect on our hospitals. Perhaps you're not keeping up, but in our neighbors to the south, they're having to airlift people because they are out of ICU beds in Hidalgo County and in Cameron County. Everything we do from this moment forward, after having a successful weekend, keeping the thousands and the masses from congregating, with our limitations on gatherings to 10 and our vehicular access, my message is simple. It almost seems like a broken record. Let's lock in what we've learned. Let's remember that every day is July 4th until COVID-19 disappears. We want to be free of this virus. The symbol of our freedom is our freedom to make decisions for ourselves, and we need to choose to live in a way that protects ourselves and others. So let me finally tell you a little bit about the testing that was referenced by Director Rodriguez. She told you there were 3,000 people in the queue. Nueces County and the city have arranged to have at least 2,500 tests available this week. It's going to take us all week to really get that many mobile drive-through testings. I would ask for your patience, but if you need a test this week and you're in the queue, help is coming. We're having to change our protocols because this new testing is not from our own lab. These are testing that we've been able to procure from private labs. So we're not going to use, for these 2,500 tests, we're not going to use our own diagnostic lab machines because we do not have those testing supplies in abundance. We will be using our own nurses, our own logistics, and we will take the swabs like always. Nothing changes, but instead of it being processed in Corpus Christi, it's going to be processed somewhere else so that we can make a dent in the great need that is testing. And so I would ask you, if they call you back needing additional information, please make certain that you give that information as fast as you can, and it will make a difference in getting you tested as soon as we can. While I was sitting in the back of the room, I received a great text from a man who I'll just identify as Eric. It comes with a great picture of Eric sitting at the Coastal Bed Blood Center, propped up with a mask. He's just given his gift of life. He is a COVID-19 survivor. He heard our plea, and he has answered the call and has saved 2 lives by giving his blood, which will be used for convalescent plasma therapy. I'm grateful to you, Eric, and for whoever heard me and our plea to get as many donors as possible. So I'd like to end by saying thank you to all of you who care enough to be leaders in your own right and taking the initiative to share the message that you can find out more information about convalescent plasma and the gift of life at coastalbedbloodcenter.org. And we still need donations. Remember, every week we need at least 50 people to be in the queue to give blood. That will help us with 100 lives. More is necessary in the weeks to come, but we have, I think, over 70 people willing to give because of what you helped me do last week. So I will be available for questions, and again, let's keep it up. Let's make certain that everything we do is in an effort to get our lives back in the next 30 days. Make certain that you create your own family plan of how you are going to stay safe and informed. Thank you.
En resumen, quiero dar las gracias a todos aquellos que hicieron su parte para evitar más salidas durante el fin de semana feriado. Fue un fin de semana muy diferente en comparación al Día de los Caídos. Lo que hicimos este fin de semana va a verse reflejado en las próximas 2 semanas. Este fin de semana me estuvieron informando sobre las muertes reportadas. Esta fue la realidad de este fin de semana. Pacientes de diferentes edades, a pesar de contar con otras condiciones de salud. Asimismo, continúa el incremento de las hospitalizaciones. Vamos a recibir la ayuda de enfermeros adicionales. Hemos expandido las unidades de cuidados intensivos. 44 pacientes actualmente se encuentran bajo tratamiento de respiración artificial. Desafortunadamente, esta no es la época de visitar el área de la costa. Les recuerdo de seguir utilizando su cubrebocas y de continuar el distanciamiento social. Les pido continuar haciendo de su parte hasta que este virus desaparezca. El Distrito de Salud va a intentar realizar 2.500 pruebas durante esta semana. Aunque esta toma va a ser diferente ya que no contamos con todos los recursos. El análisis se va a llevar a cabo en otra ubicación, así podremos ayudar a los cerca de 3.000 residentes que se encuentran en la lista de espera. Por favor, done sangre si se ha recuperado del virus para así continuar salvando vidas. Más información en el portal www.coastalbendcenter.org.
Thank you. Well, I think the judge and Peter pretty much laid out the report for the week and where we are. I did want to say on behalf of the citizens, we are very grateful for those that heard our message, and obviously it got out of town because a significant number of those I think that were planning to come to the beach didn't, from San Antonio and Austin and Houston. And so it works. We thank you for that. For those of you that have a dislike for wearing a mask, I don't like to wear one either, but I think it's in the best interest of our community, and I would encourage you to wear it. It creates a little discomfort for a few minutes that you're wearing it, but I think in the long run, it will save some lives possibly and save some people getting sick. And so I really encourage you to wear the mask. Since people can't see your face, your facial expressions when you're wearing it, just grit your teeth when you're wearing it, make you feel better. But if you can protect your friends and your neighbors, I think that's exceptional of what we're trying to do. And while we hear the numbers of the deaths, most of our reaction is, well, that's just a number or a statistic. Let me tell you, those are folks that have loved ones, mothers, fathers, sisters, brothers, uncles, aunts, many friends. It's very personal to them. It's very real. And I think we need to always keep that in focus. It's not just a statistic that you're hearing here in terms of the deaths. And for someone to lose a loved one or friend under any circumstances is a tragic experience and a painful experience. So do what you can. And you'll never know whether you were any positive impact on the individual or any negative impact. But you need to remove that doubt. So wear your mask, make a contribution to someone else's life and health, and to your families especially. So we thank those that responded positively to staying away from the beach, practicing social distancing, and for those that were inconvenienced by some of the parking out on the island, we apologize for that to a certain extent. But it served the purpose for which we were trying to get, and that is to keep people off of the beach and congregating. And so your temporary inconvenience is over now, and you can get back to your normal routine in terms of your access to your properties. But we want to thank everyone that did participate, and I think you'll see the results. Hopefully it's quicker than the next 14 to 20 days, but if it comes as quick as the next 10 to 12 or 14 days, that's great. But hopefully, we'll be able to nip this in the bud and we'll be back to our routine life. But until then, we've got to row in the same direction, keep the faith, and stay strong. So thank you.
Estamos muy agradecidos con las personas que han estado en sus hogares y que han usado sus cubrebocas, pero este uso va a evitar muertes y más contagios. En cuanto a las muertes, son personas que tienen familiares, no son solo una estadística, es una experiencia muy trágica. Le pedimos que siga tomando sus medidas para ayudar a su familia y seguir con salud. También le quiero pedir disculpas por todos los inconvenientes en la isla, pero fue con una meta en mente. Los resultados de estas medidas las veremos en unas 2 semanas. Esperamos que los resultados positivos se vean antes de esas 2 semanas.
Okay, that concludes our prepared remarks for today. The judge, myself, and the mayor, and Annette possibly via Skype are available if there's any questions from the media.
Several of our viewers got some questions. One of them is, some of them got tested and they're wondering what's taking so long for the results to come in.
Okay, well, it depends on where they got tested. So some of the testing agents like this, the National Guard sends their samples to numerous laboratories across the state of Texas. And we have seen that it takes time when they do it. When the city does our testing, we analyze the material right here on Greenwood, at our Greenwood facility. So it's within the same 12 to 24, usually 12 hours since the sample is taken. I don't know about commercial labs and others. Judge, you want to add?
I just wanted to comment about what we're about to do. So he's right about the National Guard testing that often does have some lag time. The testing that we've procured for this coming week, the process is going to be, we'll take the sample on the day you test. It'll then have a 1-day transit, so that afternoon it will move to its laboratory location, and then that next day we'll begin the testing. And so we think within 72 hours of testing, you will get your reverse alert telling you, giving you a link to your results. If you test positive, the health department is going to call you. If you receive a reverse alert to a link, that's most likely going to be your negative result. Okay, you're not going to be told you're positive by a text. This is very important to make sure you give us a cellular so that we can use the reverse alert system. If you don't have a cell phone, be sure and give a number, of somebody that will get in touch with you to give you this information. We all know somebody in our family that does have a cell phone. So just so you know, the next round of testing, this should not be a problem. If they have experienced the lag, I can tell you that the longest I've seen is probably maybe a week. And so if you do have concerns, it might be that there's some wrong information like a cell number, because we are giving results in by reverse alert.
We've also been hearing that some people who have been recently put in the hospital for COVID-19 were treated weeks before. Is it possible to get COVID-19 again or twice?
Have you heard, Judge? I mean, go ahead.
I asked Director Rodriguez that very question, if any of the infectious disease specialists have seen that. They have not seen that in our community again, and so we have heard that there are people who will remain positive for a long period of time, but I specifically asked that question, and Annette informed me that Dr. Ram had said that this time they did not believe they had seen any evidence of that. But remember how early we are in the scientific understanding of this virus. So as they say never.
As far as hospital capacity, where do we fall in that, and what are the hospital's plans to keep up with the increasing numbers of hospitalizations?
So right before this press briefing, I had the opportunity to speak with Christus Spawn, and they are the ones carrying, I think, the heaviest load right now. They have, a tremendous amount of people in ICU and, in fact, just COVID patients. He told me he could expand to 60 more beds, 60 more ICU beds, and so he felt that was the expansion that would sort of represent the last expansion. They have been expanding this entire time. Many of you know that HCA also has a capacity, and so I do not have their updated numbers. But are we strained? You bet we are. How do you know? They have, both institutions have asked for the state of Texas to help with nurses for staffing. So, a lot of it, remember, is not just about the bed. Always ask the question, do you have the staff for those expansions? And so it's going to be a little bit of both. But we are not having to airlift anybody, but I am in shock of how quickly we have developed from the evolution of, call it 2 weeks ago when we had 40 people in the hospital to today where we have, 200 and, what was it, 260? I mean, we have quadrupled, and we are fourth in the state of Texas for average cases per capita in growth. We were number 1, and now we're number 4. Not a distinction I hold in high regard. Scary to me is Victoria, which is leading the way, and the reason you should care about that, and we should all worry about our brothers and sisters up there, is because they are in our regional CBRAC region. So they're in our healthcare region where we, where we have some crossover. And so I think that they are equidistant almost between Houston and Corpus Christi. And Houston does not have capacity. So Victoria is concerning, and I know the congressman, it's his hometown, it's our congressional district, and what happens to them matters to us. So that's scary to me. I need to look at their numbers next. But we've got some groom, Courtney, but it's quickly evaporating. And every time you get 200 positives, we're seeing, I looked at the numbers, did the math, and we're seeing a 7% ratio of hospitalizations from active cases to hospitalizations. Apples to apples. Active cases, active hospitalizations shows a 7.1% ratio. That's bothersome to me. Every 100 people, 7 people are going to be in the hospital. That means the 200 that got diagnosed today, on the law of averages, not the law of reality, we're going to see that many hospitalizations. That's why the cumulative rate is so gut-wrenching. We've got to go backwards. We need to return to days where we were in the teens. Yes, sir?
What's the status on the Memorial Unit?
So the status on Memorial Medical Center is such that I spent the weekend discussing with both CBRAC and a really awesome coalition, Courtney, that's developed between the Nueces County Medical Society and some of our federally health qualified centers. And the first thing that we are talking about is what are the impediments to Memorial? It's not the construction. The impediment is staffing and logistics on administration. And today I spent some time working on how would the medical records work, how would the administration and staff, if every hospital is already strained, how do we expect to get new staff there? And so we talked through those issues, and I visited with both Johnny Hipp and the chairman of the board, John Martinez, and we all agreed that it should be discussed at an upcoming meeting of the hospital district as soon as possible, because I believe that time is of the essence. I think that we should have a place for surge, and if the only impediment is, how are we going to staff it? Well, those are the same questions we face every day. I would rather come into the fall season knowing what I know now about what happened to us in 2 weeks. Everything we predicted 2 months ago when we put together this plan has absolutely come true. And so I think that I believe it to be imminent, Courtney, to be discussed again. Remember that it is in the hands of the hospital district to move forward. It's their building, and also the tenant, Krista Spahn, would have to agree. But we are getting closer to understanding how to remove the impediments of administration and staffing. And in the meantime, you might be interested to know, we could talk about it more tomorrow, we have developed a concept of a COVID clinic, a free clinic where active COVID patients could go and receive free medical care with volunteer medical corps. And this is something that I'm very hopeful will keep our emergency rooms, free from the overrunning of patients that don't need to be hospitalized but need to be in a doctor's care. And there are things that we can do to help them take care of themselves to hopefully prevent a hospital stay. And we do have a proposal ready, ready for the hospital district and the emergency management team of the city and county to look at this week. I think that's also part of this alternate care. How do we help our hospitals? We've got to create other ways for people to get assistance. So 2 different things, not to get confused, but we do propose that clinic in the Memorial Complex, but not in the hospital. There's a building called Physicians West, and it's owned by the hospital district, and it's in the complex, and it's totally empty, but it was a clinic at one time, so it's perfect to be utilized in that way again. Those are the kinds of things we're talking about, and those are the kinds of things we want to act upon sooner rather than later.
Okay, do we have any other questions? Okay, great. Well, thank you, the community, for watching. Thank you for the media covering today's press briefing. We'll be back tomorrow at 5 o'clock, and we'll keep you updated between now and then should it warrant. Thank you.